for the longest time, I thought I would be an engineer. I thought about medicine as a career, but I wasn't necessarily serious about it. I enjoyed the technical aspects of engineering and, building things and designing things. And so that naturally appealed to me a lot, which actually in a latter stage was what partly attracted me to interventional cardiology too.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. Welcome to another Monday. I'm particularly excited for this episode because we've been wanting to do this episode since the beginning of this year, sort of first quarter in March, when I happened to meet my guest in person at an annual scientific session in Washington, D.C. And, here we are, approaching the end of second quarter. But I'm grateful that we now get a chance to sit down and talk to him and, have him on the show. So for the introduction, my guest on the show today is Dr. Janarthanan Sathananthan. He goes by Janar. We were having an offline conversation and he told me that even his parents call him Janar. So Dr. Sathananthan is an interventional cardiologist. He still practices interventional cardiology at St. Paul's and Vancouver General Hospital in Vancouver in British Columbia in Canada. He's also the chief medical officer in interventional cardiology for Boston Scientific. I think it's fascinating that he manages to still practice interventional cardiology. It's a high intensity career, balancing his appointment, an important appointment with an industry leader in Boston Scientific. So with that introduction, Janar, or I would still go by Janarthanan, because I think I'm fairly comfortable in pronouncing your name. Welcome on the show, and thank you so much for doing this for us.
No, and first of all, thank you very much for having me on. I've had the pleasure of listening to some of these podcasts, so congratulations to you for just the longevity and a lot of the interesting guests you've had on. And it's an honor to be a guest today.
Yeah, no, the honor and the pleasure is all ours. So Janar, I will like to start by asking you about your sort of journey to interventional cardiology. I think before we even get to interventional cardiology, I think a sort of insight into your childhood, your teenage years, early adulthood, as to when were the seeds sown, to sort of pursue medicine as a career and to become a physician. I think that would be very insightful and fascinating for our listenership here.
Yeah, sure, absolutely. I will, I'll start by saying that I'm a Sri Lankan Tamil by background. That is a very important part of my identity because my childhood was very much that of an immigrant story. My parents were immigrants. I was an immigrant. And it's that basis of which a large foundation of how I approached life was born from and was influenced by. So I was born in Sri Lanka. I left when I was 1 because of the civil war that was happening there. And so it led to a little bit of a disconnect with the country that I was born in because of the war. I've never actually seen the place that I was born in. I've never seen a photo of my parents, for example, under the age of 30. And so I was always sort of a citizen of wherever I ended up being. And so, from leaving Sri Lanka, we lived in the UK for a while, then Nigeria, and then most of my childhood up until the age of 10 was actually in Southern Africa and Zimbabwe, which was great while we were there. And then we moved to New Zealand when I was 10, of which the majority of my teenage, and then that's where I did all of my training. And then subsequently, I came to fellowship in Canada, and now I live in Canada. And so that influence of sort of that immigrant story is, and we can touch on that a little bit more, but has always been a big part of how I've approached life and how my parents have influenced me growing up. in my formative years.
Yes. Wow. I think I'm going to get to this later in the interview. It's cricket season, and sort of you've named Zimbabwe, Australia, and New Zealand, and those are the Commonwealth nations, which all play cricket or have played cricket. So I'm gonna bring cricket into growing up in down under for sure. But before we get there, that's a great background for all the motivation that you may have garnered growing up. What were the remnants of if you still remember them, the remnants of the discussions you've had with your parents growing up, trying to use Civil War as a background here, and sort of pick those. I wouldn't call them as pain points, but sort of points on which, I think these points end up being fulcrums on which careers are made, or these points end up being, motivation spotlights in careers. Do you remember any such conversation, when you were growing up with your parents, in either in Zimbabwe or in New Zealand as a teenager?
Yeah, look, there isn't maybe a specific moment that I can recall, but what I will say is that there's moments throughout that resonate for me. And, you growing up in a South Asian household, I would say that my experience is very familiar to many others in that your parents show you love by the actions of what they portray. You're not necessarily sitting there having a beer with them or necessarily anything like that. But my parents demonstrated their love very emphatically, and I always felt a great responsibility to deliver on the sacrifice that they always put me, and I'm an only child, so I just say me, before any of their desires. So, the moving around different countries, the reason we went to New Zealand, it was very clear that they did that for my education, for my future. Everything that they did was to set up a future for me. And so I will always be internally grateful for that, but I've also felt a great responsibility to deliver on the sacrifice that they put through their life. Like, they had to undergo a lot of hardship at various stages, a lot of it which I saw. I didn't necessarily feel like life was difficult because they never made it feel like that, because they took on that burden. But one statement that always came through to me that they would always say, and my father would always say this, is that we never had a country to go back to. Just from where I grew up in Sri Lanka with the Civil War, it was never possible to go back. So wherever we came or moved to, failure was not an option. You just had to outwork beyond any hurdle or any problem. And so that's always something that's resonated for me. And certainly as I've grown up, I look back and think about those messages I got as a child more and more, particularly now that I have children.
Yeah, it's, sort of the bedrock of, common values that we're born and bred on. I think some of the things that you've shared, are very, very resonant with, my upbringing. Yes, I think, our parents sacrifice a lot for us, and, sharing the common ancestry here, the South Asian ancestry. And I think all their actions and all their motivations and how they plan their vacations and where they want to go or not want to go is revolving around the lives of their children. And, I think sort of the focus is very clear from the get-go. And that is, seek education and as much as you can. And, just strive for excellence. And I think there's something to be said about that, given one could argue, I mean, given the sheer propensity of how many of us end up being in competitive fields like interventional cardiology, was there any point in time? I mean, I know that it was a responsibility for you to deliver on all fronts and to take that to heart and make sure that their sacrifices are accounted for, which is phenomenal and fantastic. Have you seen the other end of the spectrum? And I bring this up because I've sort of seen this, not necessarily within medicine, but in the larger South Asian diaspora in the West, where some South Asian children or kids who were born and bred not in for example India or Sri Lanka or even Australia, New Zealand or Zimbabwe, but in North America, actually have resented this. Does that resonate with you? Have you seen that? Because that is the other aspect of I wouldn't call it stringent upbringing, but upbringing with a lot of expectation.
Yeah, and you could see, I've certainly seen that. I felt that in myself at times, but my parents never pushed it necessarily beyond a limit. They were always supportive. But I've certainly seen it in other, family, friends where it can suddenly manifest as a form of rebellion, right? And that can certainly be the other extreme. So, and I would say that approach doesn't necessarily work with every child, every person. For me, I like to be challenged. Part of it was also just from the school that I went to was very much that similar kind of mentality. And so it's something that I resonate with, but I can totally understand that it's not something that everyone would necessarily be attuned to. Certainly my daughters don't respond in the same way that I did when I was a child. So it's it's different time, but also people are different.
Yes, no, thank you for responding to that comment so eloquently. I thought I would just bring it up to sort of balance the conversation because, I certainly identify with the upbringing that you've had. And, my response was very similar to how you responded. However, I think at Parallax, I always want to make sure that I'm also bringing to the fore the other end of the spectrum of, like you said, the rebellion. That could be a response to a stimulus like, a common stimulus that I know many South Asian, families have or share, with their children. So let me ask you this. Was it tough for you, Janar, moving continents and countries when you were that young? How was it? How difficult or how enriching, either difficult and enriching, you'll tell us, was it for you to move continents and sort of adjust to a completely new environment growing up as a child and then as a teenager?
Yeah, look, it comes with pros and cons, just like anything in life. I've always appreciated the fact that I had that life experience because I've had very unique life experiences growing up in many different countries. So it's given me something that I never undervalue, which is a really global perspective of the world and people. Unlike if I had only grown up in one country, potentially. But one of the challenges is that everywhere I've gone, I've always been, and I don't necessarily like to use this term, but I've certainly been what would be considered a minority within a lot of those communities. And so that came with challenges as a child growing up. And it also at times, certainly as a kid, I struggle with this less nowadays as I've grown up and a little bit older. But as a teenager, I had a lot of issues with identifying with who I belonged to in terms of a group, right? In New Zealand, I wouldn't necessarily say I was fully attuned with being a Sri Lankan because I never grew up there. But at the same time, I was also not a Kiwi, as you would call it, or a New Zealander, because, I had not grown up in that environment either. So I naturally gravitated to people that had similar upbringings to myself. So, like anything in life, pros and cons with every situation, but I wouldn't change any of it.
Being identified as a minority, how do you think that shaped up your upbringing, into early adulthood? And also if that was a catalyst in your career, from the lens of performance, is where I'm trying to get at with this question.
Yeah, and I guess it's a delicate topic to talk about, but I think it's a really important one to talk about. Because this was an experience that my father lived, and I do genuinely hate the term minority, but I think maybe people of color is maybe a better term, or there's probably a better term than even that. But in New Zealand, there were not a lot. When I moved, everyone was a first generation migrant. And so you were very much a different face in those communities. You sounded different, you looked different, the way you acted and behaved because of your cultural background was different. And that was irrespective of what ethnic group you were. And my father, I could see quite palpably how discrimination impacted his career. I mean, he was a dentist, he was a professional, but he always worked that much harder to get something that was equivalent. And I didn't naively thought it would not impact me in my career, but he would always say to me throughout when I was a teenager, be prepared to work 3 times harder. And he would never say it as a negative. It would always be, it is a gift to have this opportunity. And if by working harder, you will always be better. It is never a downside to put more effort in. You always get rewarded. And so I think about that a lot nowadays, in particular, because that advice has never taken me down the wrong pathway, because he never pitched it in a negative way, in a sense. It was just something you had to do. And it was actually not too dissimilar when I was going through medical training, and my friends and I were applying for different specialties. And if you were a person of color, it was just almost culturally accepted that you would have to work harder. And that was my experience, and that was my experience of my friends, of my classmates, and other people that I knew. And so it certainly toughened me up a bit. But also when I moved to Canada, it was very refreshing. And now sort of working in North America, it's very refreshing that mentality does not exist nowadays. And also it's 2024. Obviously there's still work to be done, but it is much, much better than it was. And I'm sure you've have had similar experiences yourself. But in that experience for me is instilled, and I'm grateful for it, just a work ethic that came from essentially discrimination, but it's a good quality that I savor to this day.
Yeah, it's inspirational the way you've put it across, Janar, and I think it also sort of is a window to the mindset, right? And that is where I'm going with this is positive mindset. In that you can spin this. I mean, your father could have spun this entirely negatively, and sort of, propelled hatred, or sort of sown in seeds, which would have not been constructive. But he decided to sort of take it in his stride and sort of impart the positive mindset to you, in that it's good to work hard, it's important to work hard, and hard work is always going to get rewarded, if not immediately, then in the long term. And I think it sort of is such a beautiful insight into his mindset and the mindset that he imparted to you, in that you can look at scenarios, you can look at situations, and you can look at occurrences in life, either as a victim or as a victor, and the choice is entirely yours. And you certainly chose to look at it as a victor, and sort of double down and put those hours in, and worked twice or thrice as hard. And your career and your CV speaks for itself. You are at an important position for a premier organization, both, clinically as well as, speaking from the industry side. So I think it's, that's the sort of spiritual lesson I take from you sharing what you just shared. And I think it's crucial that we live our lives with that mindset, in that universe is happening for us and life is happening for us, and it's not happening to us. And I think that is such a powerful way. It's empowering if you live your life like that, in my opinion.
Yeah, I would agree. Look, I think you're giving me too much credit. I want to give my father most of the credit here, and my parents, really, because he would always say that any problem, the only thing you can control is how much effort you put in. And that was one thing that he would always say to me. And the other facet that he would be a variant of that is that there's nothing difficult in life that you can't overcome with more work. And it wasn't just the words that he said, but there was a very memorable time for me in my childhood where, moving from Zimbabwe to New Zealand, my father had to resit all his exams in dentistry because he didn't have a degree from New Zealand. But he would wake up in the morning, he would study, he was lecturing at the university as well. He was studying for his registration exam, and he was doing a master's. So, it's not like my father ever sat and played with me for every weekend, but for a 2-year period, I just never saw him. But I saw the amount of work and effort that he put into setting up a future for our family. So he demonstrated it with sheer work ethic. And to me, I worked probably a quarter of, if that, of what he did in his life. And so I had a very real example and a mentor in my life that I was very fortunate to have. And I know not everyone has that gift. And so I'm certainly very appreciative for what they did for me.
Yeah, no, and, thank you for, being the son that you're being for him. And I'm sure, this makes him incredibly proud. It certainly resonates. A lot of this, resonates with me in person as well. So I'm gonna switch gears here, Janar, and ask you about when you decided that you wanted a career in medicine, because I'm sure that would have been an important sort of turning point, if not turning point, sort of an important foundation or an important milestone for you.
Yeah, look, I think, being of Sri Lankan background, you're kind of always surrounded with medicine as a career that you should maybe consider. But actually for the longest time, I thought I would be an engineer. I thought about medicine as a career, but I wasn't necessarily serious about it. I enjoyed the technical aspects of engineering and, building things and designing things. And so that naturally appealed to me a lot, which actually in a latter stage was what partly attracted me to interventional cardiology too. But a lot of it shifted for me when I was 15, and my dad had a heart attack at 48, actually. And so he got one of the early drug-eluting stents back in those days. And so there was something, and I didn't immediately want to be a cardiologist at that point, but I sort of had a sense of you went to the hospital, you saw what they did. And it was at that point that I was like, okay, well, there's something about medicine that kind of resonates with me. And so that's partly the decision that drove me to do it. I didn't necessarily think about cardiology specifically at that point. That came a little bit later, but it was that teenage experience that ultimately drove me towards medicine as a career.
Yeah. And what was the moment when you thought that, or when you decided that it would be medicine and cardiology? And certainly medicine, internal medicine is a broad specialty, and then cardiology is a subspecialty.
I was actually and life is ironic in the sense that sometimes there's a lot of symmetry, and so some of this, and you will understand why when I say this next story. But so I did a 6-year medical degree, which is a little bit different than in North America. So I came straight out of high school and went straight into medical school, and which is the colonial kind of system. Growing up in New Zealand. But when I was a 5th-year med student, I did a elective in Melbourne. And it was at that point that I decided I want to be not just in internal medicine, I wanted to be a cardiologist, and not just a cardiologist. I wanted to be an interventional cardiologist. I was that specific when I was a 5th-year med student. And that was because up until that point, I was dead set on being an orthopedic surgeon. I read around it. I loved going to the OR. I assisted. I had lots of relationships with a lot of the surgeons there. They were very generous to me. And I just picked this elective rotation. And the very first person to show me, I remember I was going to the cath lab, was my first week block that I had. And the very first day I went in, the very first person to show me a coronary angiogram and talk me through it was Professor Ian Meredith, who, had my job at BSc, or a slightly different version of this job. Not quite this job, but before I did. And so he was the one when I was a med student that showed me this angiogram. It was a woman in her 30s that had just given birth, and 2 days later had chest pain, and she actually had spontaneous coronary artery dissection. I still remember him saying, "Look, this is tram lining of the arteries, and if you see these tram lines," because Melbourne, the public transport is trams, so I think that's why they called it tram lining in Melbourne. But that was a sign of dissection. And the second case was a STEMI in a middle-aged gentleman. And, he arrested, they shocked him, they opened him up. And he was just an inspirational kind of figure for me as a med student. He was super dynamic. He was very eloquent, very skilled in terms of research. And I saw that interplay between science and technology, and I was completely converted from that moment. And it was really just that exposure and his sort of gravitas at the time when I spent that elective, and so that's what shifted me to interventional cardiology.
Of course, Professor Meredith and his gravitas as an academic and as a cardiologist, and I'm not surprised that that's the path you chose. I mean, I think it a lot also. I think that time in your career, you're so impressionable that you come across as someone as Professor Meredith, and you want to be like him and you want to emulate him. So I completely understand that. I think what also resonates a lot. Actually, there's a lot of common themes here between how my life shaped up and how yours did. In that you wanted to be an orthopedic surgeon. I wanted to be a cardiac surgeon. And that changed in 4th year of medical school for me, because it's the same colonial system. I went to medical school, 6-year medical school out of high school in India. And then I think it was in 4th year when, it shifted for me in that, I did not enjoy the lack of critical thinking in surgery. I mean, nothing against surgeons, and this is just my opinion, but I thought that there was more diagnostic algorithmic approach to medicine and cardiology. And then I obviously enjoyed doing things, procedure from things with my own hands from a procedure perspective. And so interventional cardiology was it for me as a medical student as well. And I think, you sort of come across personalities at the time, sort of just have this indelible impression that that's the path you want to choose and follow. So your training was in Australia then, all of it?
In New Zealand entirely, yeah, in Auckland.
Okay, and then what was the time in your career then you moved to North America?
So I had finished cardiology training. I did a coronary PCI fellowship in New Zealand, so I did 1 year there. I then moved to Canada, to Toronto for a year to do a second complex PCI fellowship. And the main reason we went there was actually my wife is also a cardiologist and she does adult congenital heart disease. And so, we mainly went to Toronto fellowship, but then ultimately, we went to Vancouver for 2 years because, I wanted to train under John Webb in structural intervention and then was fortunate to be hired on in Vancouver.
It's fantastic. So I want to talk to you about your journey into industry as a clinician, as a structural heart interventionalist working at a premier center, at a premier global center, I should say. What was the motivation to move to industry? How did that come about?
Yeah, it was actually quite a bit of a surprise, I would say, for me. Working in industry was not something I had in my career plan. But I had interactions with industry mainly just because I had amazing mentors that helped me interact with industry. And so, from a professional perspective, Professor Webb has been just a figurehead for me, and David Wood as well has been a very important mentor, both of them for me. And they gave me opportunities to interact with industry. So, in my early career so far, I was just working with different companies and things, but I never thought that I would work in industry. But I was approached by Boston Scientific to see if I would be interested in the position. And so it came as quite a bit of a surprise because I did not anticipate they would, I kind of imagined that they were looking for somebody later in their career, as typically most companies do. And so it's an offer that I thought about for a while, and obviously given the uniqueness position of it, and it's obviously a privilege to and an honor to do something like this. And so it's an opportunity that I just thought maybe once in a lifetime, and reality is most of these are. And so I struggle with saying no to opportunity, and so it's been a very enjoyable ride so far.
Yeah, so just educate our audience as to what that role entails, Janar, and sort of how do you balance this with your still active clinical role as an interventionalist? I know that your time spent in the cath lab now, vis-a-vis when you were a full-time interventionalist, is different. But still, the fact that you're able to wear both hats together is inspirational, and I'm sure the audience would love to hear from you as to how you balance the two acts together.
Look, I mean, I think you touched on this a little bit earlier in terms of showing in terms of what you like to do with Parallax and showing the two sides of things. I don't want people to sort of listen to this podcast and just assume that, I have some unique skill set that I can do this, or that somehow you can achieve everything in life and have perfect balance. It's not easy. I'm still learning how to do it. Even before I took this job on, it was something that I struggled with. I would say by personality, I am a workaholic. I wouldn't necessarily say that I have the best balance. And it's certainly not easy to juggle both of these things and both of these roles together. It's, they're both demanding. Do I have a lot of time for hobbies and friends and things? No, I don't. Whatever time I have left, I focus on my family, and I have a young family. So I don't know if I have the right answer for you, but in terms of achieving balance, I don't think it's necessarily easy. I'm still trying to figure it out. But I think for me, the opportunity to do something new and to learn is always a fun ride, and so that kind of makes up for all the challenges in many ways.
Yeah, no, and I really appreciate the candor. In part why I want to have these conversations at Parallax and sort of bring the human aspect to all of us, who want to do things outside, more often than not outside of our quote unquote 7 to 4 or 8 to 5 kind of job. So no, I appreciate that. I appreciate the candor, and I appreciate how you put it together, as a response for our listenership. I've sort of, I don't even use the word balance anymore. I just call it work-life optimization. There are days which work will take precedence over some of the personal aspects of our lives. And then there are days which will allow us to be more engaged with our families compared with, how engaged we are at work. And I just try to optimize as best as I can while still learning how to juggle everything together. So that response was absolutely perfect. What is something which you have learned about industry, which you thought you knew, but again, maybe sounding cliched a bit now, Parallax kicked in and you sort of looked at it from another perspective. It was a refreshing lens for you. So is there anything of that sort or nature that you've come across which you thought you knew, but there was another angle to it?
Yeah, it's a great question, Ankur. I'll say I'll leverage Dr. Ken Stein, who's our global chief medical officer within the country. He's within the company. Sorry, I had an interview with him before I joined the company, and he said to me, and he sent me some articles which were, in circulation that he had written just about when he transitioned. He was. One thing that surprised him was how genuinely focused so many people are in the company on improving patients' lives. And I think there's obviously the company's for profit, but I was also similarly sort of pleasantly surprised that when I interacted with my teams, and at Boston Scientific, we have a large number of men and women that have been with the company for a long time. And a lot of them, when I asked them, why have you stuck with the company for so long? Their response for the vast majority has been that we think we're making a difference. And for me, I find it as a unique privilege to be able to see both sides, because now, for example, if I go into the cath lab, like, I was in the lab a few weeks ago and do an IVUS, I'm also able to think, wow, there was this engineer that I met, in Galway that help design this particular component. There's the marketing team that's trying to understand how we can improve this. And there's so many, men and women that don't necessarily get to see the benefits of the technology that they help develop. And I think as a physician, we underappreciate sometimes, and certainly I have, just the unique privilege we have that we're an end user of all this work. It's really, you're in a very privileged position that you get to use even as simple as we take for granted, for example, a coronary wire or a balloon, but that's somebody's whole life developing that, designing that, making it better, getting it approved. And so for me, that has given me certainly a completely different perspective on things. And it's been a pleasant one.
Yes, what a great answer. And, I think sort of, just reinforces one, privilege, and two, the sense of humility that all of us should have, whilst we're working with these technologies and products in the cath lab, that, just a lot of effort multiplied by multitude of human lives has gone into finessing the product that you're using. And you could still be criticizing it without even having the insight as to how much effort has gone into developing it thus far. So, just a beautiful answer, and thank you for sharing that insight with us. Given what you went through in your childhood, early adulthood, even in training, discrimination. How has that shaped some of the initiatives or some of the work that you want to do with this position? Because it is an empowering position, or so I would perceive it to be, and you can correct me if I'm wrong. How do you want to use that experience again as a catalyst to do something with this position that you have with an influential company in our field, to better the lives of those who may now be in a similar position as you are, from a patient perspective?
Yeah, I mean, I'll start with a few answers around that. In that, the first point you brought up was about being in this position and how it empowers you. The first comment I'll make is that you certainly do. Certainly, in my position, I'm fortunate that you do have an important role in helping that vision of the company. Not every role like this is the same across different companies, and that's one thing people should be aware of. It's not, this title is a title, but the makeup of the job can be very different. Now, while I have an important voice, I want to emphasize the team approach that comes with this, right? I mean, I am just one voice of many talented men and women that are part of a larger team that are driving towards a vision. So overall, I mean, for me personally, where I would like to see is that I think if you look at all the areas of interventional cardiology, one thing I've really appreciated about this role is that you get to interact with all the smartest minds in the field. Because, compared to when I was purely in clinical practice, I largely just interacted just with, structural heart folks. And now you get to interact with the bright minds and coronary and interventional heart failure, all these other fields, and you see all the technology that's out there, and all the bright engineers and CEOs that are trying to come up with things. And so, you have exposure to stuff and you're constantly learning. So really where we want to go, I think, and I say we because it is an initiative for the company, is that there's lots of other important therapy areas that I think we can make an impact. Where I would like to see things go is certainly for us to bring technologies to new therapy areas that don't really quite yet have a minimally invasive option right now, or to do something that's better. Also, there's really an important global initiative that I'd love to develop in the future, which is we'll have more focus on, in that if you look at, for example, coronary therapies, I was talking about this with our team in India earlier this year. The growth of PCI in our Asia Pacific region is exploding far more than it is in the United States, which often gets a lot of the visibility. And in fact, most of where we're seeing the clinical need, and in medtech, ultimately, we're talking about patients. We're not talking about consumers. That's where the clinical need is, and the clinical need is not just from availability of devices. You've got clinicians that are hampering for education to get access to tools, to learn more about imaging, learn more about large bore access. And I think as a company, we can help these regions a lot with that. And so for me, those are the two aspects that I'm very excited about in the future.
Yeah, no, excellent. I mean, I couldn't agree with you more. I mean, if you look at global burden of disease, actually South Asians, harbor a third of that burden. This is some of the work that I've done through, my nonprofit, which in part also supports Parallax. And, through the initiative, which is CHAI, it's Cardiovascular Health in Asian Indians. We were sort of wanting to bring this topic to the fore, having written about it and, certainly also, participated in clinical investigation in the same space. I could not agree with you more. that region needs to be highlighted. And patients need us there. Also our colleagues need us there. So, thank you for having that vision globally for that region. I'm sure that my extended family will be the benefactors of your efforts. So congratulations on just having that vision on your docket there for your company. I think it's important to have that vision, because if the mind does not know, the eyes will not see. So it's important for the mind to know, and you certainly are in the know-how. So thank you for that.
It's a focus for the company as well. So, and I can't take all the credit, but the company thinks very globally, and so that's certainly an area we want to contribute to. And I hope your family is not the beneficiaries or need to be the beneficiaries of that anchor, but hopefully not.
Yes, and what I was trying to say that there was that if they are in a position where they have to be, they would certainly have access to all the technologies and the physicians with appropriate training and know-how as to how to best take care of them. That was the verve of that comment. I certainly would not hope that they are in a medical emergency of any sorts also. So final few minutes of the podcast here, Janar, and this has been such an engaging, fascinating conversation, and thank you for your answers and thank you for the engagement. I'm going to come back to cricket. I don't know if you have the time to follow cricket. I certainly do, not the tournaments, but when it's the World Cups. So I tend to follow. Do you still follow cricket, or was cricket a part of your?
Oh, massive part of my childhood. I mean, we still talk about that late 90s Sri Lankan World Cup cricket team with Sanat Jayasuriya and Kalra. Those guys are like national heroes. So, they redefined how you play ODI cricket. So we're still living off those glory days. But it's been great to have the T20 World Cup in North America. You can actually watch cricket easily at a time zone. So I've been enjoying that the last couple of weeks for sure.
Yeah, no, absolutely. Thanks, Janar, again for having this conversation. Any closing remarks for our listenership? Any closing remarks for Parallax?
No, I'll just finish by saying thank you very much for having me on, and I wish you good luck with future episodes, and thank you so much for having me on.
Thank you. Again, thanks for your time. And, to those who tuned in, do share your feedback with us. Rate us and review us on Apple Podcasts, SoundCloud, and Spotify. Do share your comments with us. We, take them seriously, and we'll see you back another Monday.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.